Hi, I'm Dr. Shirley. I'm a family physician here with the Department of Family Medicine at Kauvery Hospital, Chennai. Today I want to talk about preventive health in women. March 8th was celebrated as International Women's Day, and the theme for this year was Choose to Challenge, which means women need to raise the bar. They need to achieve many things, for which they need to be mentally and physically fit. So in this context, preventive health is extremely important, so that women can be aware of the changes that happen in their body in different stages of life and accordingly take the required necessary steps to avoid health problems. So we have many preventive strategies to assess their risk and do the screening test at the right time, detect conditions early and treat them in the initial stage. This way we can avoid a lot of unnecessary surgeries, unnecessary treatments, and overall the health of the women can be better. Some of these screening tools we have, an example is mammogram. Mammogram is a specialized X-ray that is taken of the woman's breast to detect any small, minute abnormality or growth, and this is recommended for all women above 40, irrespective of their risk factors. Women less than 40 who are having risk factors can approach the doctor and be tested accordingly with either ultrasound or MRI. And mammograms are done on a yearly to a biannual basis after 40, depending on the requirement. In addition to this, we also teach the women how to do self-breast examination, which can be done periodically and again helps us not to miss cases in the initial stage. The next screening tool we commonly do in preventive health screening is the Pap Smear. The Pap Smear is a screening test in which a few cells are collected from the lower part of the uterus called the cervix, and this is checked under the microscope for any abnormalities or any suspicious presentation. This will help us screen and prevent cervical cancer. This is done for all women above the age of 21 up to the age of 65, and again it is done once in 3 years. We also check for the presence of HPV virus in this Pap Smear after the age of 30, which again is one of the main causes of cervical cancer, and it can be prevented with the immunization or the HPV vaccine, which is done anytime after the age of 9 till the age of 26. Another important problem women face, especially the postmenopausal women, is loss of bone density, which leads to osteoporosis, osteopenia, and other things. So these can be screened with the help of another specialized X-ray called the DEXA scan. This tells us early stages when the changes can be picked up, and the woman can be prophylactically treated with whatever nutritional supplement she requires before she ends up with a serious problem or fragility fracture. So as you can see, there are many changes that occur age-wise as well as during the different stages of a woman's life, but some of these screening tests will help us detect things early and take care of it in the initial stage. Women are also counseled on important things like family planning, pregnancy, sexual health and hygiene. These things are all done as a part of preventive screening, and most importantly, the mental health. She is assessed for any mental health problems, referred to the specialists in the field, and accordingly taken care so that both mentally and physically a woman can be fit. Thank you.